The bony framework of thorax is called the thoracic cage. It is formed by the 12 thoracic vertebrae posteriorly, 12 pairs of ribs laterally, and sternum anteriorly. Thoracic cage has two apertures, superior aperture and inferior aperture. Superior aperture is also called the thoracic outlet. It is bounded by the first thoracic vertebra posteriorly, the inner borders of the first ribs, and the upper border of the manubrium sterni. Each rib articulates with the vertebral column posteriorly. The head of each rib articulates with the body of the numerically same vertebra and with the body of the vertebra just above, and the tubercle of the rib articulates with the transverse process of the numerically same vertebra. Anterior end of the rib, it has some articulation with the costal cartilage. Costal cartilages are bars of cartilage connecting the upper 7 ribs to the lateral edge of the sternum, and the 8th, 9th, and 10th ribs to the cartilage immediately above. The cartilages of the 11th, 10th ribs and in the abdominal musculature. The costal cartilages contribute significantly to the elasticity and mobility of the thoracic wall. In old age, the costal cartilages tend to lose some of their flexibility. But not all ribs are typical. Have a look. The upper 7 ribs, and we call them the true ribs, we have a typical articulation with the vertebrae behind and with the sternum in front. But the lowest 5 ribs, they have some features. The rib number 8th through 10th, we have the articulations between their costal cartilages. Really, there are some tiny synovial joints between these costal cartilages, and altogether we make the costal arch. We call these 3 ribs the false ribs. And lastly, the lowest 2 ribs, the rib number 11 and rib number 12, we have no anterior attachment at all. That's why we call them the floating ribs. They just lie freely between the muscles on the posterior wall of the abdomen and the lateral wall of the abdomen. Sternum is the flat bone in the anterior wall of the thorax. It composed of 3 parts. The first, the highest part, is the manubrium sterni. The next long part is the body of sternum, and finally below here is the xiphoid process. Manubrium sterni has some notches on it. On top of it you can see the sternal notch, which also is called the suprasternal notch or jugular notch. Laterally here we have the clavicular notches as well. Clavicular notches are actually the articular surfaces which articulate with the clavicle. Below here we have also the costal notch. The costal notch is the articular surface of the manubrium sterni which articulates with the first rib. The sternal angle or angle of Lewis is formed by the articulation of the manubrium with the body of the sternum. It can be recognized by the presence of transverse ridge on the anterior aspect of the sternum. This transverse ridge lies at the level of the second costal cartilage, the point from which all costal cartilages and ribs are counted. The sternal angle lies opposite the intervertebral discs between the 4th and 5th thoracic vertebra, and this is a very useful clinical landmark. The body of sternum, it also has some costal notches on both sides, and there are 5 of them. The ribs will come here to make their costosternal joints. The body itself, it articulates with the xiphoid process in the xiphosternal joint. Xiphoid process is a tiny piece of bone here below which hasn't any articulations and lie freely. It serves, however, for the attachment of the abdominal muscles. Typical rib has four main parts: the head, which articulates with two neighbor vertebrae and has two facets for this articulation. The narrow part just below the head is the neck. Then this tubercle here is the costal tubercle. It articulates with the transverse process of the vertebra and has some facet as well. And the long part is the shaft. On this rib, you can see the costal cartilage is attached to the anterior end of the rib. Laterally here must be the angle, the costal angle. Not very clear on this modeling. And on the interior surface of the rib, here you can see the shallow groove. This is the costal groove which houses the intercostal vein, intercostal artery and intercostal nerve. The first two ribs are a little bit different from ours. They are flattened from above down and have the superior surface and inferior surface, and also the inner border and the outer border. The posterior end also possesses the head, the neck and tubercle. The scalenus anterior muscle is attached to its upper surface and inner border. Anterior to the scalenus anterior, the subclavian vein crosses the rib. Posterior to the muscle attachment, the subclavian artery and the lower trunk of the brachial plexus cross the rib and lie in contact with the bone.